RIO and Dianova share a long-standing commitment to recovery, social inclusion and human rights-based treatment. From your perspective, what concrete added values does this partnership bring to the global drug policy arena, and how does it strengthen the credibility of civil society as an implementation partner for member states after CND 69?
The key plus with this partnership is the connecting the lived experiences and the international policy work. Dianova brings a global network with many different organizations who does work for the same as us, and connecting us all together to share these experiences and use the voice of the people who used to live with drugs or who are living with drugs to help us use our experiences in the international policy making.
CND 69 once again highlighted the move from declarations to delivery. In that context, how do you access the current balance between control, public health, prevention, treatment, and human rights? And where do you see the strongest momentum for a truly people-centered drug policy? Now,
what we are seeing globally is a gradual shift toward a more people-centered and public health-oriented approach to drug policy, where prevention, treatment, recovery, and human rights are increasingly recognized as essential components. At the same time, recent developments in Norway illustrate why the human rights dimension is so important in practice. Reports from the Norwegian National Human Rights Institution and reviews by the Office of the Director of Public Prosecutions of Norway have highlighted cases where drug users were subjected to coercive measures that were not sufficiently grounded in law, raising concerns about violations of fundamental rights. For us, this underscores an important lesson. Even countries with strong welfare systems must continuously review their policies to ensure that responses to drug use are proportionate, legally sound, and respectful of human dignity. Going forward, we believe this requires clearer legal safeguards, stronger oversight of police practices, and greater emphasis on health and social responses rather than punitive measures. It also highlights the importance of including people with lived experience in shaping policy reforms so that drug policies are both effective and consistent with human rights standards.
If CND 69 was about scaling what works, what are your key takeaways for the next 12 months in terms of influencing national policies, expanding access to quality treatment and recovery support, and ensuring that the voices of people with lived experiences shape the implementation phase?
And we are focusing on keeping up the good work we're doing with the user organizations in political processes, and we are going to keep working as we have done the last years tightly up on the government and lawmakers, and we're going to keep making sure that the voices of people with lived experience is due and used in these processes.
Thank you so much.